Hi, everyone. We are doing sarcopenia and its effects on older adults. My name is Nicole.
I'm Anne.
I'm Xiaoyan Liang.
And I'm Jenna.
So our muscles have a lot of beneficial purposes in our body. They help us move, they stabilize our joints, they help our posture. However, once we turn 30, our muscle mass begins to decline, and some quicker than others. So sarcopenia is the loss of skeletal muscle mass and loss of skeletal function or strength. Some of the correlations with sarcopenia are physical disability, lower quality of life, increased frailty, increased hospitalization, and extreme cases can be death. So some of the main causes I focus in are environmental, chronic disease, and consequential age changes. Environmental causes are obesity, sedentary behavior, inadequate nutrition, and dental or oral disease. Chronic disease, or anything that really sparks inflammation, are GI disorders, rheumatoid arthritis, osteoporosis, type 2 diabetes, kidney disease, inflammatory bowel disease, and congestive heart failure. So there are more diseases, but these are the main ones that seem to be a cause. Consequential age changes are chronic low-grade inflammation, hormonal changes such as changes in insulin, testosterone, estrogen, and DHEAS, and the loss of neuromuscular junction, which is the decrease in fast twitch muscle fibers. So who's our at-risk group? We know that older adults are more at risk, but specifically those who have low physical mobility, inadequate nutrition, high sedentary lifestyle. Those over the age of 60, specifically 30% of them are affected, especially those over the age of 80, and over 50% are affected. So, and those suffering from disease or chronic inflammation.
So there are a few types of sarcopenia, starting with primary sarcopenia, which is also known as age-related sarcopenia. This is diagnosed when there are no other specific causes that are evident other than age. And there's also secondary sarcopenia, which is diagnosed when there are causal factors present other than aging. So for example, physical inactivity would be a secondary causal factor, with whether that is due to sedentary lifestyle or from disabilities. And there's also sarcopenic obesity, which is when lean body mass decreases at the same time as fat mass increasing. This commonly happens as we age and is common in older adults. In terms of muscle fibers, sarcopenia mainly affects the fast twitch type 2 muscle fibers, and it does not affect the slow twitch type 1 muscle fibers as much. The consequences of sarcopenia include a decrease in muscle mass and strength, which leads to an increased risk of falling. Sarcopenia is a determinant of fall risk, and can impair activities of daily living and lead to disability, loss of independence, poor quality of life, and death. And a few other consequences include increased morbidity and mortality rates, loss of mobility, which can lead to a physically inactive lifestyle, which can further worsen sarcopenia, impaired quality of life, osteoporosis, dyslipidemia, increased cardiovascular risk, metabolic syndrome, and immunosuppression. So the most common comorbidities of sarcopenia include cardiovascular disease, dementia, diabetes, respiratory disease. This high prevalence of sarcopenia as a comorbidity with other health conditions highlights the importance of screening and diagnosing sarcopenia as soon as possible.
So the next part is the assessment and diagnosis of sarcopenia. Since many study groups have different diagnostic criteria for sarcopenia, I will mainly discuss it based on European Working Group on Sarcopenia in older people. The three criteria for diagnosis of sarcopenia are low muscle mass, low muscle strength, and low physical performance. Many methods can be used to evaluate muscle mass. Anthropometry assessment like body mass index and body circumference are very simple to measure, but it may not be able to evaluate muscle mass accurately. BIA is a low-pressed method that calculates an estimate of muscle mass instead of measuring directly. However, measurement errors might be present due to hydration status of patients. Medical imaging is a very useful and accurate assessment tool to quantify muscle and fat mass. DXA has been widely adopted and it has relatively low cost amongst the three medical imaging methods. Through DXA, a particular skeletal muscle mass can be measured based on EWGSOP. ASM adjusted by height square is the most common index they use. And here I showed cutoff points for both men and women. The limitation of DXA is that it does not include trunk muscles. CT and MRI are considered the most accurate imaging methods to assess muscle mass. The difference is that MRI is more suitable for long-term follow-up because it has no radiation exposure. However, both of them are limited by high cost. Next, in order to assess muscle strength, hand grip strength test is a simple and inexpensive method. You can also see the cutoff points for low strength here. In terms of physical performance, gait speed is highly reliable test that is widely used for sarcopenia. SPPB is a composite test. Gait speed is also included in it. And the picture on the right can help people to check if they are having sarcopenia through these steps.
And now treatment and prevention. Treatment focuses on improving the muscle mass and muscle function. And it is mainly based on number one, nutrition, especially for age-related sarcopenia. And the second, physical activity. When we talk about nutrition, we mainly focus on high quality protein intake, especially leucine amino acid enriched food. We can find this in all kinds of meat, whey protein in milk and Greek yogurt. And for vegetarian individuals, they can eat soybean, nuts, and tofu. The amount of protein is matter too. The recommendation is 1 to 1.2 grams per kilogram, or it is 25 to 30 grams in each meal. So how much 25 grams of protein look like? It's like as eating 1 cup of a Greek yogurt mixed with 1 ounce of almond, or eating 4 to 5 ounces of hamburger or salmon fillet. Many studies show omega-3 fatty acid attenuate inflammation and age-associated muscle loss. Tilait study shows that older adults taking daily omega-3 for 6 months increased thigh muscles volume by 3.6% and hand grip strength by 2.3 kilograms. Many studies show that replacement of vitamin D in persons with low levels will increase strength and function of the muscles, decrease falls, and it's also associated with less mortality. So vitamin D levels should be measured in all sarcopenic patients. The second element of prevention and treatment is the high-intensity physical activity. Many articles consider resistance exercise as the primary treatment of sarcopenia. A systemic review of 37 randomized clinical trials done in 2019 provide an overview of how different exercise intervention affect sarcopenia in older adults. And they found that although low-intensity exercise is sufficient to induce muscle strength, the recommendation was toward the high-volume, high-intensity resistance training exercise because it has the highest evidence to improve muscle mass, muscle strength, and physical performance in older adults. And they recommend 20 to 30 minutes of resistance training 3 times a week. Anabolic intervention like testosterone and growth hormone are well-known medication for bodybuilders to increase muscle mass and strength. But this medication have several side effects, mainly the growth hormones. For that reason, it is commonly used to treat secondary sarcopenia due to hormonal deficiency. Thank you for listening.